So the relationship between testosterone and prostate cancer, that saturation theory, again, but as a male starts to lose his testosterone, what ends up happening? You know, male saying you can tell how much testosterone a guy has by how big his gut is, okay? Well, you increase the amount of fat. When you increase the amount of fat, you increase the conversion of testosterone to estrogen. That happens in fat cells. So the lower the testosterone goes, the more fat they accumulate, the more that testosterone goes to estrogen, and we know what estrogen does. We look at, when the labs come over, we look at in the males that testosterone to estrogen ratio, the same way we look at progesterone to estrogen ratio in females. So what you want to do is you want to keep that testosterone level up in relation to how much estrogen you have. Decreased libido, here's the other theory. As testosterone starts to drop, sexual drive drops, the number of times that you have sex decreases, the prostate gland, the fluid that it manufactures, if you're not getting rid of it on a regular basis, okay, what ends up happening? What happens to any fluid if it's standing in a 98.6 incubated body that has an outside channel, the outside world? You know, we see it with nursing home patients when they lay in a bed and they can't cough out fluid out of their lungs. It's lung infections. We see it with ear infections. You can't get the water out of your ear. It becomes stagnant. It becomes infected. It's a low-level infection, not always detectable. It causes no symptoms at all. A digital exam might show it, but that low-level infection, when you get bacteria up there, bacteria, it's got to eat, it's got to do, and the assault on the tissue there brings about the inflammatory response. And we know inflammation. You could cause cancer in your, you know, just by doing this all the time on your hand. You do this long enough. And where that stimulation comes from, your body doesn't necessarily care about what's causing the stimulation. You could be refluxing acid all the time and burning your esophagus, and that inflammatory response. You could be getting sunburns all the time. Whatever is stimulating the growth of that cell is considered to be a cancer risk. Diabetes is important. Men that are low in testosterone have twice the risk of becoming diabetic. Cardiovascular, they're looking into that. Again, all those things you would assume that would be nice and healthy with testosterone when you're young. Why would you think that these things wouldn't start to fall apart when you start losing it? The concerns with female with respect to estrogen, and this is one of those things, well, if you're doing hormone replacement, why should a female care about getting estrogen? Because it's a stimulator. More females will die because of cardiovascular problems than breast cancer. So when you lose your estrogen, you're losing that part of your testosterone that is responsible for so much, your bone growth. Your cardiovascular system is, you know, it's all muscular, and that's, so the notion that a female should not replace estrogen once she gets into menopause, but that's why we got to look at the labs. You get a prescription, you take it for a while, and we draw the labs again, and we see where you're at, and we just kind of make sure that we don't get out of control. Ways to replace testosterone: it's a gel, it's a cream, we can give an injection. It's a pellet now that they're putting in. You got to replace a pellet every 6 months. Cost of testosterone, like progesterone, very inexpensive, very inexpensive. I would say part of the reason what drives me to have this educational session is that my concerns are the economy. Again, I promised my wife I wouldn't talk about the economy, but I think once we realize the enormity of the situation that we have gotten ourselves into with a $15 trillion debt, our debt to GDP is almost at 100% right now. It's at like 99.2%. Something's going to give. There's going to be changes. There's going to be decreases in spending. If you're relying on the government for this, you're relying on the government for that, they're either going to debase the value of the currency and cause a whole bunch of inflation, or is this going to disappear? One way or another, we are all going to have to become more responsible for what it is that we do. It doesn't matter if it's being employed or doing this or doing that. My concern, where healthcare is concerned, is the spending slow, and we'll have to look at some of these things that we've been talking about. So thank you all for coming, and appreciate it. If there's questions that anybody has. Anybody with any questions?
I had my prostate out, and the literature, and you tonight alluded to the fact that maybe you ought to be on testosterone to help build muscles. Would that be a safe thing to do?
Well, I mean, what the data has shown is that increasing your testosterone after you've been diagnosed with prostate cancer, that has to be evaluated by your physician. There are so many other variables that may come into play. That's that patient physician.
Oh yeah. Okay. Well, I just shared those. My PSA now is 0/0.0.
Right.
So,
right.
So in one way, I like to use testosterone, but the other way, the literature suggests maybe that's not the right thing to do.
It's a relationship thing with the physician and how the physician feels about what the research is showing. If he happens to side with the notion that men start getting fatter and they produce more estrogen, and that's more stimulant, more potent stimulator, then he would be interested in replacing the testosterone.
The data shows that if you're 2 years post-diagnosis, post-treatment, and you have no recurrence, then it's safe to use.
2 years post,
2 years out.
2 years out, and there's been no occurrences. Thank you, Dr. Ellis. Any question over there?
If you could repeat the questions, then we could hear them better.
Okay, sure.
If the person's facing another direction.
Yeah. Okay. The question was whether or not he had his prostate removed, and it's been several years. He wants to use testosterone. Is it considered safe? And Dr. Ellis had indicated that the 2-year post prostatectomy, if PSA and everything is good, yeah, absolutely.
What do you do when you were talking about the cholesterol? When you have real high cholesterol, do you stay on cholesterol medicine, or your body take it and sway it out?
Doc, you want to answer that one? That's a.
No, you don't take cholesterol.
Do you take cholesterol medication? Let me let Dr. Ellis answer that one.
Basically, if you're taking a hormone replacement, it'll lower your cholesterol naturally. So if your HDL is high enough and your LDL is low enough, the ratio is good, you don't take anything.
Just leave it go.
Yes.
Even if.
So I asked the doctor to come here to help with those. Thank you, Dr. Ellis.
Hormone replacement therapy, I've read, it thickens your blood, which can cause a higher risk for heart-related incidents.
Yes. Question is hormone replacement therapy thickening your blood. If you look at the warnings on birth control pills, the vast majority of them have to do with some thrombolytic event, because you're going to be stimulating the bone marrow similar to what testosterone does. We look at the hematocrit in a male when the labs come over to make sure that your blood isn't too thick to start with, because you had testosterone, well, it's going to start increasing the division of those cells and the growth, and you're exactly right. You're exactly right, and that is something that, but again, realize this isn't about jacking your levels up. There's that happy medium always. I don't care what it is. You do too much of something, you're going to get into trouble. If you have too little of something, you're going to get into trouble. What we're looking at is the chart that showed, kind of with the females, we don't want to give you enough hormones that you're going to start having a cycle again. We want to up your estrogen enough that it keeps you healthy. We want to make sure your progesterone is high enough that it's protecting your cells. But when you overload your system with a birth control pill estrogen that is just going to totally dominate things and prevent, you're absolutely going to run into issues. If you're a guy and you want to jack your testosterone level up to 12, 1500, you're going to run into problems, But that's, we're looking at upping things up just to make sure that systems are functioning properly and, all those good things that hormones do.